How to treat dog diarrhea. Diarrhea is a common problem for our canine companions. Many cases of diarrhea are not serious and will resolve given the correct home care. By taking the right action, you can help straightforward, uncomplicated episodes of diarrhea settle down without a trip to the vet clinic. Still, sometimes the problem is serious enough to require a trip to the vet. Treating your dog's diarrhea through diet. Put the dog on a 12 to 24-hour fast. The presence of food in the gut causes contractions of the bowel wall to push food along. But if the dog has diarrhea, these contractions can be over-enthusiastic and push food through too quickly in the form of diarrhea. The answer is to withhold food for 12 to 24 hours to let the over-sensitized bowel wall calm down and act normally. Provide fresh drinking water. During this period of fasting, let the dog have access to clean, fresh drinking water. Monitor the water bowl to make sure it is going down, i.e., he is drinking. If he is drinking well, then the risk of dehydration is drastically reduced. Ease your dog off his fast with bland food. After the fasting period, do not put the dog straight back onto his regular diet. Instead, offer him food that is gentle on his stomach and easy to digest. An ideal bland diet avoids fatty foods and rich, red meat. Offer your dog chicken, the actual meat, not then a chicken-flavored food. Don't give your dog chicken skin, only meat. Combine the chicken with boiled white rice, pasta, or mashed potatoes. Avoid milk and dairy products, as many dogs have a lactose intolerance which could trigger diarrhea. This means no butter in the mashed potatoes. Bland food produces a low volume and pale stool, so don't expect your dog's feces to look totally normal. What you are looking for is a stool that can be picked up as a sign he is on the mend. Try a prescription diet from the vet. If you know that your dog doesn't respond well to the bland, home-prepared meal, ask your veterinarian for prescription dog food for healing stomachs. Diets such as Hill's ID and Purina N are proven to speed up the recovery time from diarrhea. Ration his portion sizes. Smaller meals give the bowel less stimulation to go into spasm. When your dog ends his fast, feed him the same amount of food in a day as his normal diet. However, divide it into 4 smaller portions and spread the meals throughout the day. This will prevent his diarrhea from returning. Transition your dog slowly back to a regular diet. Once your dog's diarrhea has safely passed, you can begin easing him back into a normal diet. Don't switch him straight back onto his normal food, as the bowel needs time to heal. Stick to the bland diet for 2 days to make sure the diarrhea has passed. Then take a further 2 days to transition him back onto normal food using the following method. Mix 2/3 bland food with 1/3 normal diet. The next day, change to 1/3 bland diet and 2/3 normal food. On the 3rd day, it's okay to put him back onto a normal diet. Administer probiotics. Probiotics are bacteria helpful to digestion that speed up recovery from diarrhea. Useful bacteria can be lost during the violent expulsions of diarrhea. It then takes time for the population to build back up again and digestion to reach full efficiency. A supplement of probiotics boosts the bacterial population. Generally, probiotics are mixed into the dog's food once a day, for 5 days. The natural bacteria in a dog's bowel differ from those in humans. Don't give human probiotics to dogs. A variety of canine probiotics are available without prescription from your veterinarian, pharmacist, or major pet stores. Do not give your dog medications for human diarrhea. Mild diarrhea should respond to the above steps. Giving your dog a drug that reduces bowel movement may hide a serious problem until it is too late. If the original symptoms do not settle after 2 to 3 days with the methods mentioned above, chances are your dog has a problem which needs veterinary attention.